October is Breast Cancer Awareness Month, and I think we can all agree that we are all aware of breast cancer. But what people are not aware of is the power of a plant-only diet and lifestyle.
One in 8 American women will be diagnosed with breast cancer in their lifetimes.
Everything about eating an animal is feeding cancer, especially the protein in animal flesh.
Is primarily related to not the amount of seeds we may plant or the amount of genes we may have that can give rise to cancer. It more relates to how we fertilize that, how we promote those cancer cells to grow over time. That's where nutrition comes into play. Nutrition comes into play back here too, but it's particularly prominent during this phase. And animal protein, as we started doing the research, we could, experimentally, we could turn on the growth of these cells. They go much more rapidly when they were fed animal protein.
There are also natural occurring growth hormones in animals, especially the milk,
signal
that feed cancer.
is IGF-1, a growth hormone called insulin-like growth factor number 1. Levels go up when you're a kid, so you grow, and then come back down. Should your levels stay a bit too high as an adult, though, there's this constant message to ourselves, grow, 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 divide, don't die, keep going, keep growing. And so, not surprisingly, the more IGF-1 we have in our bloodstream, the higher our risk for cancer. More IGF-1, more prostate cancer. More IGF-1, more breast cancer. Just a few days of walking and eating whole, healthy plant foods, and our IGF-1 levels drop low enough to reverse cancer cell growth. What if we stick with it? Going to some predicant spa and getting healthy for 2 weeks is one thing, but what about long term? Does your IGF-1 start to creep back up to standard American diet levels again? No. Here's after 11 days, and it just gets better. People eating plant-based diets for 14 years have half the IGF-1 in their bodies, and more than twice the amount of IGF-1 binding protein than those on the standard American diet. Higher IGF-1 levels were just associated with animal protein intake. In fact, the plant protein seemed to decrease IGF-1 levels. So no wonder there was no net effect of total protein intake. Animal protein appears to send a much different signal to our livers than most plant proteins. So even those vegans eating the same amount of protein as meat eaters still had lower levels of the cancer-promoting hormone IGF-1. So it's apparently not about excessive protein in general, but about animal protein in particular.
The lump that was in my breast was about the size of $0.50. In 1 month, it was about the size of a dime. That's how dramatically it shrunk.
The same cholesterol in animal flesh that causes heart disease feeds cancer.
Since cancer feeds on cholesterol, maybe we can stuff some chemo into it as like a Trojan horse poison pill. That's probably why people's cholesterol levels drop so low after they get cancer. The tumor is eating it up. In fact, patient survival may be lowest when cholesterol uptake is highest. High LDL receptor content in human breast cancer tissue seems to indicate a poor prognosis, suggesting that breast tumors rich in LDL receptors may grow rapidly in the body.
Here's someone who found a message.
I was diagnosed with breast cancer in April of 2011, and I had gone through 4 months of treatment, through the standard treatment. Just went through 4 months of the strongest chemo that they had. Ended up having a bilateral mastectomy. I was 29 when I was diagnosed, and just was in the whole whirlwind of shock and everything else, and just going through the treatments. So this is what I'm doing, this is what my doctor says I need to do, I don't want to hear anything else. But at that point, after 4 months, and it didn't even kill the cancer, it just shrunk it so I could have surgery, I watched Forks Over Knives, and it was like a light came on. And when I saw Ruth Heydrich and I saw Dr. McDougall on there, I thought, why didn't anybody tell me about this? And Dr. McDougall sent me articles on breast cancer and nutrition, and Ruth Heydrich also shared with me her story, and so that's how I first found out about Dr. McDougall. Since I made the change in November, I've lost 95 pounds so far, and I went from a size about 22 plus. I kind of stopped checking after a while. It was just huge. But I went from about a 22 to now I'm currently in a size 8'6". I had a complete physical in January, and they looked at everything. Everything was excellent then. All my numbers were great. My doctor said everything was good. I had my last scan, CT scan and PET scan, had all that done. That was in February, I believe. It was right before I went to the 10-day, and everything, I'd been following it since November, and there was absolutely no cancer in my body at all.
Doctors are not taught nutrition, only how to implement drugs and surgery.
The first thing people have to realize, and I deal with a lot of cancer patients, is this is a slow-growing disease. And they've got time to think about this.
In many cases, doctors will try to rush a person to make a decision right then, and they scare them by saying, we have no time to wait.
That I needed to immediately do chemotherapy, radiation, and then a bone marrow transplant. And that they were also going to do a double mastectomy just in case I ended up with breast cancer.
The tumor becomes resistant and actually turns this chemical poison into food. But then it doesn't work anymore. All it does is poison, poison. You cannot heal with poison.
They've had the chemotherapy and the radiation, and for a while they thought that they were cured.
Over 90% of the people that have cancer will have a cancer return. And this is what they're telling us.
Well, you think about it as recurrence. It's actually not recurrence at all. It's just continuation of the disease.
She went to operation on Monday. They shocked her with chemotherapy. 2 weeks later, she was dead. And they said that she had an overreaction to the chemotherapy. What the hell was that overreaction to chemotherapy?
If you had breast cancer in 1930 and you have breast cancer today, your prognosis is pretty much the same. Nothing has really changed.
When studies have compared treated and untreated patients, they show untreated patients actually live longer than treated patients.
The money from fundraisers needs to go to nutritional education, not the drug companies.
In the 1970s, my dad did research in the laboratory, and he found that the chemical that was most effective at turning on cancer cells is the protein in milk. It's called casein. He said in all his years of research, he never saw something more effective at turning on cancer than the protein in milk.
First of all, I'm one of the few doctors in the world that thinks diet has anything to do with health, period. Health, period, even constipation. To go so bold as to say diet has something to do with the cause of cancer really gets ears perked. And then if I went so bold and said the body never stops trying to heal itself, and if I told you that a diet can promote healing of cancer, like breast, colon, and prostate cancer, I mean, some of you out there would say, that's so novel. My doctor says diet has nothing to do with cancer. Well, I can tell you for sure, the body never stops trying to heal. And I've seen people heal completely when they've had a whole body full of cancer. Breast, colon, prostate cancer. So it does happen, and it's reported in the scientific literature, and you should never give up.
Proper food is the cure to cancer. Animal protein is the cause of cancer. Plant food, whole unrefined plants are the cure. Switch to a low-fat, whole-food, plant-only lifestyle and take charge of your own health. Go to my website, onesingleact.org, and learn everything you need to know and all the recipes you need and all the information about protein, because cancer absolutely sucks.